What is the normal AFP reference range for liver cancer screening? Imagine trying to catch a small leak before it becomes a flood. That's kind of what liver cancer screening is like, and one of the tools doctors use is a blood test for alpha-fetoprotein, or AFP. In healthy adults who are not pregnant and don't have liver disease, the normal AFP level is generally less than 10 to 15 nanograms per milliliter. This means if your AFP level is below this range, it's usually considered normal. AFP is a protein made by the liver and the yolk sac during fetal development. After birth, AFP levels drop significantly and stay low in healthy adults. However, if AFP levels are higher, it can sometimes point to certain health issues. Elevated AFP can happen in liver cancer, also called hepatocellular carcinoma, but it can also be seen in other conditions like germ cell tumors, chronic liver diseases such as hepatitis B or C, and cirrhosis. During pregnancy, AFP levels naturally rise, so pregnancy can affect the interpretation of the test. Liver cancer screening, AFP is useful because it can help identify people at higher risk, especially those with chronic liver problems. When AFP levels go above 200 nanograms per milliliter, it is often a sign that liver cancer might be present. But it's important to remember that many people with early or small tumors may have AFP levels that are still within the normal range. That's why AFP testing isn't used alone to diagnose liver cancer. It is combined with imaging tests like ultrasound to get a clearer picture. It's also worth noting that some people with liver disease may have moderately elevated AFP levels without having cancer. Conversely, some people with liver cancer may not have high AFP levels at all. So, a normal AFP level doesn't completely rule out liver cancer, but it can be reassuring. In summary, the normal AFP reference range for liver cancer screening in adults is less than 10 to 15 nanograms per milliliter. Elevated AFP levels can lead to further testing, but always in context with other factors like medical history and imaging results. Regular AFP testing is most helpful for people at high risk, such as those with chronic hepatitis or cirrhosis, and should be part of a comprehensive approach to liver health. Remember, always consult your healthcare provider for personalized advice and interpretation of test results.